What causes borderline personality disorder, BPD? Borderline personality disorder, BPD, is a complex and multifaceted mental health condition, and its exact causes are still not fully understood. However, research has identified a combination of genetic, biological, and environmental factors that likely contribute to the development of BPD. The interplay between these factors makes BPD unique in its onset and manifestation. This article will explore the various potential causes of BPD, helping to better understand why some individuals develop this disorder and others do not. 1. Genetic factors. There is growing evidence suggesting that genetics play a significant role in the development of BPD. People with a family history of personality disorders, particularly BPD, are at a higher risk of developing the condition themselves. Twin and family studies have shown that BPD tends to run in families, indicating that there may be a genetic predisposition to the disorder. Example, if a close relative, such as a parent or sibling, has been diagnosed with BPD, an individual's risk of developing the disorder increases, suggesting a hereditary link. Key fact: genetic factors are thought to influence aspects such as emotional regulation and impulsivity, which are central to BPD. 2. Biological factors. Certain biological factors related to brain function and structure may contribute to the development of BPD. Research has shown that individuals with BPD may have abnormalities in areas of the brain involved in emotion regulation, impulse control, and decision making, such as the amygdala, prefrontal cortex, and hippocampus. Amygdala: this part of the brain is responsible for processing emotions like fear, aggression, and pleasure. In individuals with BPD, the amygdala may be overactive, leading to intense emotional reactions. Prefrontal cortex: this area is responsible for impulse control and decision making. People with BPD may have underactivity in the prefrontal cortex, making it more difficult to regulate emotions and make thoughtful, measured decisions. Hippocampus: this region plays a key role in memory and emotional processing. Research suggests that individuals with BPD may have a smaller hippocampus, which could contribute to difficulties in processing past experiences and emotional memories. Key fact: these biological factors likely interact with environmental influences, leading to the emotional dysregulation, impulsivity, and instability that define BPD. 3. Early childhood trauma and abuse. One of the most significant contributing factors to the development of BPD is early childhood trauma. Many individuals with BPD report a history of neglect, abuse, physical, emotional, or sexual, or traumatic events during their formative years. Childhood trauma, especially if it occurs in the context of unstable or dysfunctional caregiving, can profoundly affect a child's ability to develop healthy emotional regulation and interpersonal skills. Example: a child who grows up in an environment of emotional neglect or physical abuse may develop deep-seated fears of abandonment and have difficulty forming secure attachments in adulthood, which are common characteristics of BPD. Key fact: the trauma experienced in childhood may disrupt the development of the attachment system, leading to heightened emotional vulnerability and a persistent fear of rejection and abandonment. 4. Attachment issues. Attachment theory suggests that the way children form emotional bonds with their primary caregivers is crucial for their emotional development. If these early relationships are unstable or abusive, children may struggle to develop a secure attachment. Insecure attachments are associated with difficulties in emotion regulation and forming healthy relationships in adulthood. Key features of BPD. Example: a child raised by a caregiver who is emotionally distant, unpredictable, or abusive may develop disorganized attachment. As adults, these individuals may have a distorted sense of self and struggle with feelings of abandonment, as they never learn to trust that their emotional needs would be met. Key fact: insecure or disorganized attachment styles are common among individuals with BPD and can contribute to emotional instability and difficulties in interpersonal relationships. 5. Environmental stressors. Environmental stressors, such as significant life events or ongoing challenges, can also contribute to the development of BPD, particularly in individuals who are genetically or biologically predisposed to emotional dysregulation. Traumatic experiences, such as the loss of a loved one, bullying, or rejection, can exacerbate underlying vulnerabilities and lead to the development or worsening of BPD symptoms. Example: a person who has had a history of emotional neglect or abuse in childhood may struggle to cope with the stress of a relationship breakup or the loss of a job, triggering a flare-up of BPD symptoms, including emotional outbursts and self-destructive behaviors. Key fact: stressful life events can act as triggers for individuals with BPD, especially when they feel unsupported or unable to regulate their emotions. 6. Neurochemical factors. Research suggests that neurochemicals, such as serotonin, dopamine, and norepinephrine, may play a role in the development of BPD. These chemicals are involved in mood regulation, reward systems, and emotional response. Imbalances in these neurotransmitters may contribute to the emotional dysregulation and impulsivity seen in individuals with BPD. Example: low levels of serotonin are associated with impulsivity and aggressive behavior, which are common in people with BPD. Similarly, dopamine imbalances can affect a person's ability to experience pleasure or reward, contributing to the feelings of emptiness and emotional instability that are typical of BPD. Key fact: neurochemical imbalances may interact with other factors, genetic, environmental, and biological, to increase the risk of developing BPD. 7. Social and cultural factors. Cultural and social factors may also contribute to the development of BPD. For example, societal pressures, such as expectations around gender roles, family dynamics, or social belonging, can exacerbate feelings of instability and emotional confusion. Additionally, growing up in environments where mental health issues are stigmatized can make it more difficult for individuals to seek help or understand their condition. Example: a person growing up in an environment where expressing emotions is discouraged or seen as a weakness may have difficulty learning to manage emotions in a healthy way, which is critical for people with BPD. Key fact: social and cultural influences can shape how individuals with BPD perceive themselves and interact with others, often contributing to interpersonal difficulties and self-esteem issues. Conclusion: there is no single cause of borderline personality disorder, BPD. It is likely the result of a combination of genetic vulnerabilities, biological factors, early childhood trauma, attachment issues, and environmental stressors. These factors interact in complex ways, shaping the emotional and behavioral experiences of individuals with BPD. Understanding the multifaceted nature of BPD can lead to a more compassionate and effective approach to treatment. Therapy, particularly dialectical behavior therapy, DBT, helps individuals with BPD build skills for emotional regulation and develop healthier relationships. If you or someone you know is struggling with BPD, seeking professional help is a crucial step toward healing and managing the symptoms of the disorder.